Hi everyone, my name is Dr. Intan Kamaruzaman from the Faculty of Veterinary Medicine, University of Malaysia, Kelantan. Today, I would like to present my innovative teaching idea, Vetverse, exploring VR application in veterinary medicine, enhancing education diagnosis. These are the team members of my project. So what is Vetverse? Vetverse is Malaysia's first VR learning platform for veterinary education. It is an original idea of FPB UMK. It is designed as an immersive teaching tool for the veterinary anatomy course, as it allows students to explore 3D anatomical features and structures using VR controllers, as you can see from the picture. This innovation supports TNL in line with IRR 4.0, showcasing local talent in advancing digital education. However, what is VR? Before that, let me introduce you to VR in the context of veterinary education. It is referring to the use of immersive computer-generated environments that stimulate clinical or anatomical scenarios, allowing students to develop practical skills, perform procedures, and understand complex systems in a risk-free setting. However, VR has been long used in human medicine with limited availability in veterinary education. Until now, there's no VR application available for vet schools in Malaysia, and existing programs had to be purchased from abroad at a very high cost. To mitigate this issue, UMK created Vetverse, which is the first locally developed VR prototype for veterinary education, giving students a more engaging and affordable way as a tool. Okay, this picture is to show you on how we conduct practical classes for veterinary anatomy. As you can see here, one class can fit 50 students and one instructor only. And as such, we have to equally divide the students into 5 groups, of which with limited sources, we have to share the specimen from one group to another and rotate. This makes it really not convenient for the student to effectively learn anatomy, and at the same time, it is not possible for the instructor to make individual assessment due to this method. And other challenges arising using this technique is that we need to provide a lot of carcass for study. For example, small animals such as cat, to large animals such as horse and cows. For this purpose, we don't have enough space to put this animal. Thus, these carcasses tend to decompose after one session or a few sessions together. This is not economic because we have to dispose of the carcass and we have to buy a new one for each of these practical costs, and this causes a lot of money. And at the same time, both instructor and the students will tend to have chemical exposure from the preservative chemicals such as formalin, which make it a very nasty ethical issues. And at the same time, the class is often fixed and is very rigid, which means the practical has to be done in the lab with the instructor present all the time. As I mentioned before, the assessment is very difficult to make for the instructor, and the learning will be not enjoyable for the students. And the benefits of introducing VR in veterinary education is because we want to create a real-life interactive environment for the learning, which means the students can examine virtual animals, perform surgeries, or even practice emergency responses in a control space because there's no live animals involved. And using VR, they can repeatedly enjoy the session as many times as they want, and this will be a great tool for revision, which improves the students' confidence and also maintain the skill, reduces the stress, which is ideal for learning complex oral procedures. And the objective of us producing or creating this Vetverse is because we wanted to evaluate the application of VR virtual reality among vet students in expanding their veterinary anatomy knowledge while investigating a potential application of VR in vet medicine subject. And because this is just prototype, we only used it within the faculty, targeting the UMK vet student undergoing veterinary anatomy and surgery courses. And as for the novelty and originality, Vetverse is the first locally developed VR platform in Malaysia. It provides an immersive 3D environment where the students can interact with anatomical structures, which is in line with the IR 4.0 priorities, positioning it as a pioneer educational tool with the potential for wider application across veterinary disciplines. This is to show you on how we developed the model. First off, we purchased the 3D tiger model from Triple Squid, and from that we redefined the model inside the Studio Max, of where we put in all the coordination and all the coding, and after that we integrate the VR in Unity 3D, and then we deploy in the VR hardware like this device, head mounted display. And after uploading it, we use it for final testing and refinement. And before we ask the participant, which is the vet students, we ask them to answer the question before using Vetverse, and we allow them to use Vetverse for 10 minutes, and after that they need to answer the question right after using Vetverse. And this is to show you on how we demonstrate Vetverse in the class. As you can see here, it is very interactive. I can just shift and drag the structure that I want to study, and then it is very fun to learn, especially if the student is a visual learner. And this is the session that we conducted with the vet students. Each of them has to try on Vetverse, and they have to provide the feedback. And we also show this to the Malaysian Veterinary Council during their accreditation visit in May 2025, because we plan to integrate Vetverse inside the existing curriculum. And as for the result, before using Vetverse, the student identified that only 29% of them able to practice without the use of live animals. However, after using the Vetverse, most of them agree, citing 87.5% endorsing it for future surgical training and diagnostic procedures. As for the usability, Vetverse is designed to be highly friendly user, which means the student can use the Vetverse with minimal training. It allows seamless navigation and interaction, making it suitable for classroom, practical, and also for independent revision. And we can easily integrate this platform into the existing curricula, which is in line with IR 4.0. And as for the impact, we believe that the Vetverse may enhance the student understanding of the complex anatomical knowledge, and at the same time it also showcases a local innovation, which means we don't have to rely on the overseas company to buy the software, whereas we can develop it ourselves in-house. And at the same time, we believe that Vetverse has the potential to be expanded into other veterinary disciplines, positioning it as a scalable and sustainable educational tool with national and international relevance. This is to show you that we have already applied for the copyright back in April 2025, and we are waiting for the approval. And this is another picture to show you that I managed to present Vetverse in India as in one of the international conference, where I was invited as a speaker. And as for the conclusion, we believe that Vetverse has the potential to significantly enhance the students' understanding on anatomical course, and its application can be extended to various domains of veterinary medicine, making it an ideal tool for revision and self-directed learning. We also believe that it should be integrated alongside traditional teaching method to provide students with a well-rounded and comprehensive understanding of both theoretical concepts and practical skills. This is my acknowledgement. I would like to acknowledge FPV UMK for giving me the opportunity to develop this software, the participant students from DVM5, Associate Professor Dr. Azmi Yusof, our consultant, and also Bahagian Commercial and Harta Etelic, ICT RMIC UMK. These are some of my references, and I thank you for listening.